Hey, this is Dr. David Hausmann with Stronghold Health, and today we're going to be going through the top 10 myths regarding chiropractic care. So number one, chiropractors aren't real doctors. Let's go ahead and go through this. In order to become a chiropractor in the first place, a licensed chiropractic physician in all 50 states in America, there are minimum classroom requirements and degree requirements. In order to even get into chiropractic school in the first place, you have to enter with a bachelor's degree. For instance, for myself, I graduated from UNC Chapel Hill with a 4-year degree in biology and chemistry. I knew I wanted to become a chiropractor, and so that was my entry point even into chiropractic school in the first place. And then it's a 4-year program to get your doctorate. So when you're looking at the total length of time, that's about 8 years of education. And medical school is pretty close to about 8 years as well. We actually go through in chiropractic school the same education requirements for a medical student for an MD degree. The main stark difference is very simply in med school, they're going to learn to prescribe medications. So they have to take pharmacology class and they have to take drug interactions classes, amongst others. So they spend a lot of classroom hours on pharmaceuticals and learning how to prescribe medications. With chiropractors, we don't prescribe medications, we work naturally with the body to get the body to heal. With that being said, we end up taking all of the classroom hours we would have used for pharmaceuticals and we end up applying that to anatomy, physiology, and differential diagnosis. So truth be told, if you stack up a chiropractor, licensed chiropractor physician with a DC degree next to an MD, we can outdiagnose MDs. And I've seen that in my own clinical experience with patients coming in, being able to diagnose problems that they have where their general family practitioner wasn't able to really give them a solution to it. And it's because we spent so many more classroom hours on anatomy, physiology, x-ray, and differential diagnosis. Also, you know, us as chiropractors, we have to go through the same state and national board examinations. There are licensing bodies that are in place to make sure that we have that same quality level of education and clinical competence. And so just the same way that a medical doctor has to go through their boards, pass their board exams, we have to go through the same thing. Number two, chiropractic care is dangerous. My simplest and easiest response to this is look at what is my cost as a chiropractic physician for malpractice insurance. On an annual, I'm looking at anywhere from about $1,200 to $1,500 for $3 million policy coverage, versus medical doctor prescribing pharmaceuticals can be up to a minimum of 10 times that amount, $10,000 a year. So that alone should tell you safety. My own clinical experience, I've done over 380,000 adjustments and haven't hurt a single person. So in terms of chiropractic care not being safe, I would argue the statistics are far in our favor that it's the most conservative and safest of many of the medical approaches or non-medical approaches to healthcare. Number three, chiropractic care is only treatment for back pain. It is true that chiropractic care is the #1 treatment approach for neck and low back pain. However, with that being said, chiropractic care is taking care of the entire framework of the human body through the nervous system. And so we have patients that we've been able to help with headaches, migraines, numbness and tingling issues, digestive problems, heart conditions, and the list goes on, because at the end of the day, chiropractic is reconnecting the brain to the organs of the body through our nervous system, through the wiring system, if you want to think about it that way. And so chiropractic care is all designed to take pressure off of our nervous system so that our brain can properly send life down our spinal cord, out the nerves, to every organ, cell, and tissue of the body, so that our body can thrive and heal from the inside out. 4, chiropractic care is expensive. I would argue that chiropractic care is one of the most affordable and conservative treatment approaches, especially considering the top 2 reasons that most people end up missing work and having sick days from their job are neck pain and low back pain. Chiropractic treatment is the #1 treatment approach, conservatively speaking, for neck pain and low back pain. There's studies that have been done in other countries and here in America. A Sweden study, for instance, that showed that chiropractic patients had significantly less sick days, less hospitalization, 60% less pharmaceutical costs, and it's because, generally speaking, the mentality of an individual to take preventative and proactive approach towards their health means that they're going to end up having less health issues in the long run. Number 5, chiropractic care is painful. Honestly, my first chiropractic adjustment from my own experience is I didn't even feel it. In fact, it felt like a huge light bulb going off, a huge burst of energy, a rush of oxygen to my brain. And again, in my own clinical experience and working with thousands upon thousands of patients, hundreds of thousands of adjustments, I can't even think of any more than maybe one occasion where I had someone that complained about pain. And that one individual had a hot disc, they were just in a car accident, they had severe trauma that they had just sustained. And so it was working with them maybe a little too soon. We had to wait a couple of days for their body to recover a little bit from that initial trauma. So with that being said, I mean, chiropractic care, like super gentle. We work with kids, newborns, all the way up to geriatric patients. One of my youngest patients was 1 minute old, and one of my oldest patients was 94. And so with that being said, chiropractic care is not painful. Number 6, if you start chiropractic treatment, you have to do it for forever. I always have to ask a question with this, rhetorical, and I know you can answer it yourself. Are there certain things that we have to do for our health? Yes, absolutely. We have to drink healthy, drink water to sustain our bodies. We have to eat clean organic food. We have to exercise and move our bodies regularly. Dental care, we have to take care of, brush and floss our teeth to maintain the health of our teeth. And so there's certain things at the end of the day that we have to do, generally speaking, for our health. The number one thing you can do to take care of and maintain your nervous system, arguably the most important system in your body, is chiropractic care. And so with that being said, does that mean you have to get adjusted for the rest of your life? Not necessarily. There's plenty of examples of people that start chiropractic care, overcome a neck or low back problem or another specific health issue, and then they don't get adjusted for the rest of their life and they do good. Arguably speaking, the ones that maintain their spine with some preventative treatment, maybe once a month or a couple times a year for realignment, end up doing far better. So at the end of the day, you don't have to, but it would behoove you to. Number 7, chiropractic care requires referrals. In my experience, we're in network with pretty much every major medical health insurance company. Arguably, we're only in the state of Tennessee, but we haven't really seen that to be the case. Most often, chiropractic care is a primary portal of entry, and in the state of Tennessee, chiropractors are actually considered a primary healthcare physician, which a lot of people don't know. And so with that being said, we are in a specialty realm where insurance coverage can be considered specialty, but it doesn't require a referral. The most that we've seen from insurances is they might require a pre-authorization, which is a document that we, the provider, have to send to your insurance company to get coverage approved. Outside of that, it doesn't mean you have to go to a different doctor to come see us in the first place. You can just come directly to us. Number 8, chiropractic care is not safe for children. BS. That's bad belief systems. At the end of the day, chiropractic care is one of the gentlest and safest approaches actually for pediatric patients. My own experience working with both of my children, my daughter Gigi, for example, we adjusted her, gave her first chiropractic adjustment while she was still connected, umbilical cord on mom's chest. 1 minute after birth, maybe it was 30 seconds after birth. It was the very first thing that I did was check the top bone in her neck to make sure the birth trauma itself did not misalign it, which it did. And she needed a lateral atlas adjustment. And so for pediatric patients, it doesn't require a lot of force. It's not snapping bones like you see for adults. It's often the same amount of pressure as testing the ripeness of a tomato for the amount of force. It's very, very gentle. There is no twisting and manipulating. For children, they still have growth plates. The bones aren't completely fused yet, so it has to be a very gentle approach. Chiropractic care is fantastic for pediatric patients. Number 9, chiropractic care just cracks bones. The truth of the matter is we actually aren't cracking any bones. I think in people's heads, when they hear the crack noise, they think a bone is snapping or a bone is rubbing on another bone, creating a pop noise. What actually happens is when we move a bone on a joint, how it articulates with the bone above or below it, your body has a joint capsule that's full of fluid and air gas. And so when we move a bone and realign it back into the right position, just like when you pop your knuckles, you hear a pop noise. And that pop noise is actually carbon dioxide or gas releasing or escaping very quickly from the joint capsule itself. So the pop noise is just a side effect of realigning the bone. Taking two bones that are out of position and putting them back in the right position, the pop noise is also a relief for many people. The pop noise itself has a side effect where the body releases endorphins, and endorphins are your feel-good hormones. So naturally speaking, if you like pop your own neck, even though you might not be realigning it to where it needs to be, you're still gonna have an endorphin rush and a feel-good hormone. So back to, does chiropractic care hurt? No, most people, it actually feels really good. We're not just popping and cracking bones, we're realigning the joint. And number 10 myth, chiropractic care is just placebo. Nonsense. There's so much research out there. You can Google and get research all day long on all the different things that have been measured biochemically speaking, anatomically speaking, with chiropractic care and the positive patient outcomes. A couple of simple examples is before getting adjusted and then after getting adjusted, seeing an increase in blood oxygen saturation. Before getting adjusted, after getting adjusted, seeing an increase in vital lung capacity. Reducing forward head positioning, for instance, by 1 inch increases vital lung capacity by upwards of 60%. That means how much oxygen you can hold in your lungs. We're talking about oxygen saturation to central nervous system and brain cells. Long-term chiropractic patients, there's a study that measured serum thiol levels. Serum thiol levels being a marker of longevity, but also a marker of the likelihood of an individual to have chronic illness. And what they found is chiropractic patients that had 2 years of chiropractic care or longer, so these are dedicated individuals that are preventatively taking care of themselves, those patients had higher serum thiol levels, meaning they had a lower incidence overall of chronic diseases like metabolic syndrome, cancer, diabetes, so on and so forth. So chiropractic care is far from placebo. Chiropractic care is clinically proven to have positive outcomes on your health. These are the 10 myths regarding chiropractic care. I hope that you enjoyed it. If you have any questions, comments, feedback, please go ahead and drop it in the comment section below and let us know if there's other content that you'd like for us to film, and please give us a thumbs up, a like, and hit that notification button so you can get notified when we have new videos drop. Bonus content, bonus myth. I know that you were thinking it while you were watching the video and you heard me popping my knuckles. I can't even do it anymore because I just popped them all, but does popping your knuckles, is it bad for your joints, or is popping your neck bad for your joints? Not necessarily. There was a rheumatologist that did a study, I don't remember the guy's name, specifically how long, so I'm roughly quoting this, but he popped all the knuckles on one of his hands and not on the other, and did it for, I think it was once a day for upwards of 2 or 3 years. And then they did follow-up x-rays and looked at the joint spacing and looked at the joint integrity and health, and there was no difference between the hand that he popped the knuckles and the hand that he didn't pop the knuckles. So just remember, when you pop a joint, especially spinal joints, it does relieve a little bit of tension. You might not be aligning it back to where it needs to be, and that's why x-rays come into play, and it's highly recommended you go see a chiropractor with x-rays, and they realign you based on those measurements. But either way, when you pop the joint, body releases endorphins, feel-good hormone, you feel better for a little while, ain't gonna hurt you. But that doesn't mean go adjust your wife and go snap your neck. Go see a licensed chiropractor.